Hi, Assalamualaikum to lecturers and friends. We are here today to discuss regarding electronic health application. Interestingly, implementation of healthcare application have become a commonplace in 2020. Electronic health become a place where patient can request appointment, update personal details, and even chat with a physician. Telemedicine is thriving, and the number of HIPAA compliance video conferencing service is growing day by day. E-health applications are the software and service that manage, transmit, store or record information used in delivery of healthcare treatment, payment or record keeping. These e-health applications are used by doctors, hospital and insurance provider to record patient health information.
The first application of eHealth is an electronic health record (EHR). It is a digital version system of patient's paper chart that has been used in the old days. EHR is a patient-centered records that make information available instantly and securely to authorized users. EHR is considered as a vital part of health information technology as it can improve the quality of healthcare provision and patients' data easily. This system can store patients' medical history, diagnosis, treatment plans, immunization history, radiology images, and many more. EHR also enables healthcare professionals to share patients' information with other healthcare providers such as pharmacies, medical imaging facilities, laboratories, and other facilities departments in a hospital or clinics. Therefore, this system can help them to give a better treatment process.
Next e-health application is telemedicine. According to World Health Organization, telemedicine refers to the use of ICT in improving the outcomes of the patient by increasing the access to care and medical information. It also can be defined as a healing at a distance, which includes all types of physical and physiological measurements that do not require a patient to travel to a specialist. And there are several advantages of telemedicine which are more accessible and effective, increase the engagement of the patient and the specialist, and also cost savings. So there are three common types of telemedicine, which are interactive medicines, remote patient monitoring, as well as store and forward. Interactive medicines refer to the situation where the physicians can assess a patient's medical history and also perform psychiatric evaluations, while remote patient monitoring refers to the situation where the physician can share information with their patient via the patient portals. And the last one is store and forwards, which allow providers to share the information of the patient with other practitioners in another location, in which it will cost less duplicate testing and also better medication management.
Consumer Health Informatics is one of the applications that designed to interact directly with the consumer with or without the presence of healthcare professionals. It can be divided into community informatic resources and provide clinical informatic resources for healthcare professionals to select groups or patients. This application is not restricted to the use of computers and telecommunications, but also include the delivery of information to patients through other media. So consumers are able to actively involve and to engage in healthcare processes and decisions. It's allowing users to share and sort information, giving them more control of their care. So this application is needed in organizing all of these informations. Consumer Health Informatics be parts of the modern concepts of public health and national healthcare policies. The goal of this application is to empower patients by giving them the knowledge they need to make their own health decisions.
Next, field of medical informatics that concern with. First, focus on analyzing and modeling consumer preferences, information needs, and information use. Second, to support consumers in searching and using health information. Third, to integrate consumer needs and preferences into information management systems in clinical practice, education, and research. Fourth, maximize the effectiveness of computerized information and telecommunication and network systems for consumers. Lastly, identifying the effects of these systems on public health, the patient-professional relationship, and society.
Health knowledge management is one of the applications of e-health, and it is a discipline dealing with effective use of knowledge in healthcare settings. People who have the knowledge, such as biomedicine librarians and healthcare professionals, process the information into systems to store it in the form of data and documentations. This is known as knowledge mobilization, which is the transfer of knowledge from formal research form into active use. Later, the knowledge is shared between research producers and users. This helps healthcare professionals to make better decisions in clinical settings. The success of health knowledge management depends on organizational factors and technological factors. Technological tools involved are such as softwares and database. And one of the importance of health knowledge management are such as it increases productivity in healthcare settings and it encourages the use of health information more efficiently.
Next, the visual health advisory. It can relieve potential crowding at healthcare facilities, allay the public fears, and consent to reading credible and verified information. For example, in this pandemic COVID-19 situation in Malaysia, patients can order their medication online via Doctor On Call. This will be delivered free of charge to their location, so that it will quickly reinstate this customized portal at this critical and crucial time to keep people safe whilst obtaining healthcare.
Mobile health. mHealth is medical and public health practice supported by mobile devices such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices to improve health outcomes, healthcare services, and health research. There are several uses of mHealth. First, providing healthcare information to clinicians, researchers, and patients. Some mobile health apps such as Apple Health App can integrate with patients' electronic health record, allowing the users to access their health data on their iPhone or iPad without clinicians' assistance. Second, for real-time health data collection and sharing among healthcare providers. Third, for diagnostic and treatment support. Fourth, for epidemic outbreak tracking. And lastly, for chronic disease management. Examples of mHealth apps are wellness apps. Some of them are weakness activity tracking apps such as Strava, diet and nutrition monitoring apps such as Make My Plate, and weight loss coaching apps such as My Diet Coach.
Health Information System. Health Information System is a system that processes data regarding healthcare, including gathering, storing, management, and transmission of data. Examples of data are electronic medical record of a patient, a hospital's operational management, a system supporting healthcare policy decisions, and the activities of providers and health organizations. As an integrated system that involves a large collection of data, security is a primary concern. The examples of health information systems are electronic medical record, electronic health record, practice management software, master patient index, patient portals, remote patient monitoring, and clinical decision support.
In conclusion, e-health application should be able to concentrate on providing good services in order for it to be able to deliver their functions properly to guarantee the best outcome for the patient care, as it is one of the information technology used to improve patient health and healthcare system, especially during COVID-19, where digital health technology is important to communicate between patients and healthcare professionals regarding their healthcare treatment. Each e-health application has their own uses and benefits, where the patient could choose which application that they are suitable with. However, there are challenges that should be highly regarded before implementing e-health, such as financial barriers, lack of IT and clinical resources, the difficulty of learning and using e-health software, time challenges, the implementation of e-health in rural areas, data privacy, and data quality.